But now we're going to concentrate on the autologous transplant. We're going to review some of the statistics. The intent is not to look into very specific statistics, but we're just going to go do a quick review as to how the field of bone marrow transplant is being contributing to the fight against myeloma and lymphoma. It starts with the beginning. This is sort of a bit outdated sort of information that I'm going to present the most updated info later. The most common indications for autologous transplant are basically myeloma and lymphoma, the two entities that we're reviewing in this case. And as you can see here, the number of transplants have been on the rise over the last probably 20 or 30 years or so. And this is a more updated information looking into the number of transplants that we perform per year back in 21. This is the latest info that we have. And as you can see, myeloma here and PCD, which is basically plasma cell dyscrasias, which are kind of similar entities related to myeloma, goes with number one for autologous transplant in about probably 8,000 cases. Here is the two different subtypes of lymphoma. Here, the non-Hodgkin's lymphoma, that perhaps is not as much as we used in the past because of the advent of development of many new strategies. And of course, here we have Hodgkin's lymphoma. You're probably going to hear that autologous transplant is also used for non-malignant conditions. It's also used. This is not the intent to discuss this today, but for other entities, non-malignant entities, also autologous transplant is used, and also has been used in the past, or about 20, 25 years ago. Autologous transplant were used for breast cancer and some of the solid malignancies, but unfortunately the results were not quite as the expected one. So that practice has been abandoned at this point. So again, just kind of the same graph in a different sort of format. As you can see here, we have the non-Hodgkin's lymphoma and Hodgkin's lymphoma, perhaps plateauing in terms since the year 2015, just kind of with less than perhaps about probably the same number of transplants. But here you see an increase in multiple myeloma. I'm going to briefly talk at the end as to why this is the situation currently. This is the non-Hodgkin lymphoma. I picked the most common one, which is diffuse large B-cell lymphoma, but of course, there are many others. And as you can see, the number of transplants that have been happening over the last few years, with some peaks around the year 2015, and then a bit of a drop, as I said, likely because of the new, I guess, technologies that we have at this point that are being reviewed today. It's very interesting to note that in terms of autologous transplant, as you can see here, this is basically stats for the same number of transplants that we saw, but tackled by or divided by ethnicity. And as you can see, there are some interesting differences between, of course, non-Hispanic whites, Hispanics, non-Hispanics, Blacks, Asian, and other ethnic minorities. This is something that has been discussed these days because of the fact that there are some differences in terms of outcomes among the different ethnic minorities compared to other races. And it's very interesting to know this. And of course, more to talk, more discussion. There are currently new papers looking into this kind of discrepancies and of course, different outcomes that are going to be carefully looked at. I'm presenting here, of course, the multiple myeloma, and again, the plasma cell dyscrasias. Here's Hodgkin lymphoma, the non-Hodgkin lymphoma, and this is something called follicular lymphoma, which we don't do as many autologous transplants as we used to do, but of course, this is still some of the entities that in which we use autologous transplant. Again, the same numbers looking to divided by ethnic or ethnicity. And as you can see, sort of along the years, how things have changed. You could say that probably is about kind of very stable sort of in terms of the numbers for the last probably 12 to 15 years. So no major differences. Kind of a new information regarding, for instance, the age as to for recipients of autologous transplants, in other words, the age of the patients. As you can see, there is a bit of an increase in terms of since the year 2015 in the number of patients over the age of 65, which is very unique with the new methodologies and the new techniques that we have in autologous transplant, better care, better supportive care, better antibiotics, and more prophylaxis, more aggressive prophylaxis, and the fact that we got more experience over the last 30 to 40 years with autologous transplant, that's what we're tending to more and more have transplants on patients of age of 65. Important to note also that with the help of some of the geriatrics scores, or we're just going to transplanting more and more of these patients. But of course, the less than 18 is kind of very minimal, but usually the one in between is between the age of 40 to 64. And as you can see, there's an increase in numbers since the year, roughly since the year 2009. Something that we look into when we talk about transplants is basically comorbidity index, which is the amount of conditions or diseases that patients may have before transplant. And as you can see here, it's very interesting because this is basically divided into by ethnicity. And as you can see here, the majority of patients, of course, come with no comorbidities, I should say. Some of them comes with a few of the comorbidities, but less, of course, when we get or talk about a score of 3 or above, we're having some problems because there's more risk to having complications, not necessarily related to transplant, but related to all those comorbidities. Comorbidities means, for instance, if you have some cardiovascular problems, lung problems, and other things that may cause trouble after the transplant. The same, again, as to how it's been divided by age. And as you can see, of course, less than 18, and in the younger population, they're not as much as with the senior population. But of course, there's still some issues in the young population, especially for patients who are patients who have many of these comorbidities just before the transplant.